Today, I'm talking about starting a practice with a focus in academic affiliations. I'm going to try and give an unbiased perspective. None of my disclosures are really relevant, other than the fact that I am in a Privademic type model where my perspectives and my motivations and goals may be completely different than yours, and so I'll try not to be too biased. In general, private practice in America and in practice in general is somewhat defined, but it's morphing and changing quite a bit. In 2016, 230,000 plus practices existed in the States, and you could see that over 60% of them were small, mostly private. A lot of the larger practices are private as well. So, private or academic practices in general are not the most common model, and most people are not in academic practice. But how do we define it? It's probably best defined by who employs you. If you're a part of an academic medical center or system, certainly if they're paying your bills directly, if they're managing you, then you are purely private, or I'm sorry, you're purely academic. Certainly these lines get blurred because a lot of people are hospital employed. They could be parts of HMOs, and which might have academic affiliations, and therefore they may be perceived as being sort of in a hybrid type model. Certainly a university medical center would be defined as an academic center if they're your employer. So when we compare academic versus private practices, what is the real difference? Most people would first come up with the thought that it's a reimbursement model issue, really with academic model usually being perceived as being more constrained with less overall reimbursement. The administrative work associated with being in private practice is perceived as being less, certainly more voluntary and more associated with management. That's not always true, but it's typically true. Research is your primary motivation along with teaching when you enter academics, but it seems like it's much more structured, typically in most academic practices and institutions, whereby you have obligations, as opposed to just volunteering and teaching when you want to teach, whether you teach physicians in training or whether you teach people who are mid-level providers or other types of students that might rotate through your offices, should you choose. Certainly clinical facilities and practice settings are very different in some academic centers versus private practice. Certainly much more bureaucratic in terms of their control, but also academic settings may also include covering clinic, which might be something that's completely different than your faculty group practice. So certainly practice settings will change quite a bit between the two. So what about private practice? This whole thing, the thought that you're going to make more money in private practice, it's pervasive. But I think that most people that are experienced in practice would agree that the most important thing about it is financial control. So even if you don't make more money, you feel as though there's more transparency, which most people feel good about. Most people want to have transparency because they feel as though they're being appreciated or as if the work they're putting in is being rewarded. You have more control over overhead, your business plan and model. You can maybe have access to other forms of income, more so in a private practice setting, whereby you can join surgery centers or maybe MRI centers, that type of thing. Certainly, as I showed before, there are many more job opportunities in private practice. And the overall perception also is that you have autonomy, not only financially, but then in terms of your lifestyle. So academic practice, it certainly depends on your perspective, but most people I think that would opt for academic practice feel as though it's more prestigious. Certainly they have influence in terms of being able to teach more, and having influence from their accreditations and whatnot, and their publications. But also they have collaboration, they have more security if they have tenure in particular, or if they're a part of very large setting. They are usually a part of a large institution whereby there's some practice momentum. The branding of the institution is going to automatically boost their practice and make it maybe easier for them to function and build their practice. Certainly in terms of negotiating rates, some institutions will pass through benefits, financial benefits, and if you have more bargaining power, you may have better plans, such as at NYU. So structured enabled research is maybe facilitated a little bit more when you're academic versus what we're going to talk about today, Privademic. It's certainly enabled, aside from the fact that it's structured, it's something that people will help you with. There might already be grant funding within your institution to help you get started. Grants in general, it's perceived that it might be easier to get grants if you are an actual employee of an academic institution, which we will discuss a little bit, but not get into too far today. So then I also think that what's most overseen and overlooked is the benefits to your family. Not only can you perhaps have benefits by your institutional, tuitions can be paid for, but also I love the fact that if you're a part of an academic institution, that you're sort of catered to a little bit more when your family or yourself needs medical care, or your contacts in general. I mean, everybody gets calls saying, can you get me in, whatnot. And certainly if you're part of an academic institution, it's going to have a much broader, span of opportunities to help people in that regard. So what is Privademic practice? In my perspective, it's the best of both worlds, but that's my perspective, as we said before. Certainly it has most of the same benefits that a private practice would from a financial perspective, and you can still get administrative and appointment type income as well. For example, being, taking on responsibilities within the academic institution. You can collaborate, as needed if you want to, certainly from the perspective of clinical collaboration, but also for academic collaboration. It's just up to you if you'd like to do research. Certainly there's going to be help, as much as you want to if you're tied into an institution. Security. I believe that the security of a large institution is traded for with flexibility. Some people believe that security is lost when you're struggling to make a dime in private practice. But certainly, if you're comfortable and your practice is strong, you'll have flexibility and mobility, and you may in fact have more financial security than you do in a major institution. You can have momentum as a practice. It just depends. That's very practice specific. You can have good branding, and that's sort of up to you to build on your own or to join a practice that has it. And then the other aspect is that although you can do research, you're paying for most of it, so it's very expensive. Taking the time off to go to conferences, taking the time out to do projects, paying for personnel and whatnot is very expensive. Grants should still be able to help you with that. It can be hard to get them. It depends on the structure of your practice. Certainly you can perhaps tie into grants that are a part of the institution that you join as a Privademic. Personally, I've seen tremendous family benefits as an NYU faculty member. I think most people would say that if you are tied into a larger institution, that you'll have more benefits that way. Not the same, but somewhat close to what you'd get if you were employed by the institution directly. As a Privademic, you have a lot of autonomy. Your lifestyle is very dependent on how much you commit to it, but certainly you have freedom of choice. I personally believe that as a Privademic, you are hit from both ends in a very hard way, and therefore you actually have a worse lifestyle than if you were just a pure academic. So how do you build a practice as a Privademic? What is the pathway that I think is the best from my experience and from people that I've spoken to? the primary foundation of the practice really is building the clinical practice, the clinical enterprise. If you don't have that, you don't have stability, you don't have the ability to go to conferences, you don't have time to do research. So building a strong practice is important. Everybody's heard of the 3 A's, which is affability, ability, and availability. Certainly that's when you're trying to attract referrals. But in general, having great clinical outcomes is the most important thing. People will send to you if they know you're good. It gives you stability. It also limits the amount of complications and whatnot that will hinder you and drag you down, and limit your bandwidth in terms of committing to a private practice, and in terms of being able to commit to both the academic aspect as well. So build strong patient referral resources. Build strong referral sources. These relationships are very important. You don't have as much time to devote to these relationships as you might if you were in a pure private practice. You need everybody to be satisfied and happy. Try and make every single interaction a good interaction. And then the other thing, as I was saying before, is the better your clinical outcomes are, the easier time you'll have. I believe that better surgeons grow quicker, that they have more efficiency, which is vital when you have such limited time constraints. And then also with the complication issues, not only does that drag down the reputation of your practice, but it just ties up all your time trying to deal with it. The other thing is that when you're going to be away a lot, you have to solidify coverage. You do have to have partners to some extent that'll help you when you're away, which you will be more often than you would be in pure private practice. And then financial management, austerity, you have to be sharp and smart with your money in order to survive. So building relationships, I believe that from an academic standpoint, as in this role, that your mentors are really going to help you. They're the ones that are going to help you advance. And this is very similar to building an academic practice. You have to establish a strong academic appointment that's going to support you, and try and pick people within that, mentors within that institution that will try to keep you on track. Whenever you're going to go away, it's going to hurt you. So pick meetings that are meaningful to you, that are purposeful, specifically that align with your goals and objectives. And then you can innovate new curriculum, and you can volunteer in committees. These are all ways to get your name out there and build your reputation and build your overall practice as an academician. So the most important thing, if you ask me, is enjoy yourself. If you're not enjoying yourself, it's not worth it at all. If you don't love teaching, if you don't love the research, don't do it. And also get your family on board, because you're going to be away a lot and you're committing a lot of time to it and money. So what does it look like? You have to balance it. You have to build what your dream is, but I would seek reference practices, like great practices like Jim Yusuf's, Jeff Coe. Certainly you can come and visit us or talk to us at the Gerling Institute. I've been in this type of practice for a while. I can give you advice if you'd like. Hire help, get people to help you as much as you can once you have an established practice. Seek funding if you can to try and help you with the cost and overhead. Refine your focus. The older you get, the more important that is. It should line up with your practice for efficiency's sake and your interests, and then align with as many collaborators as possible. Build it. So in conclusion, I believe personally that Privademics is the best of both worlds, but that's very biased, and you have to define what your goals are. You have to figure out what's important to you. And in my opinion, there's no clear shade of, it's not black and white. You can dip in, you can do things, you can teach a course here and there. You could do whatever really pleases you, and still be within the category of Privademics. Just remember that it's extremely taxing. You have to make difficult choices. Choose between a family vacation like spring break and the American Academy of Orthopedics, or you have to choose how much money you're going to spend, all these different things that are very taxing when it goes into Privademics. But I would say be a clinician first, and build the practice, and then that will support the research and allow you freedom to do so, and build relationships as much as you can.